Greetings from FCCU Lahore. My name is Mohammad Waqas Ali. I'm the director of the Population Research Center at FCCU. It is my honor to welcome all guests, FCCU faculty member, our chair, our co-chair, Dr. Zeba Sattar and Dr. Jonathan Addleton, and our esteemed panel, which we have been waiting to hear from. The topic of our panel discussion today is demography and its role in understanding the COVID-19 crisis in the world. I would like to begin this event formally by asking Professor Shuja Waqar to recite from the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم لا يكلف الله نفسا إلا وسعها لها ما كسبت وعليها ما اكتسبت ربنا لا تؤاخذنا إن نسينا أو أخطأنا ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين. Allah does not obligate anyone beyond his capacity. For him is what he has earned, and on him what he has incurred. Our Lord, do not hold us accountable if we forget or make a mistake. And our Lord, do not place us. And our Lord, do not make us bear a burden for which we have no strength, and pardon us, and grant us forgiveness, and have mercy on us. You are our Lord, so then help us against the disbelieving people. Sadaqallahul Azim.
Thank you, Professor Waqar. I will now invite Mr. Daud Rafiq to recite from the Holy Bible.
I read word of God from Holy Bible, Psalm 46. God is our refuge and strength, a very present help in trouble. Therefore, will not be feared, for the earth be removed, and though the mountains be carried into the midst of the sea. Amen.
Amen. I will now invite Mr. Suleiman Khairullah from the CLT department of FCCU to please explain the netiquettes for this panel discussion.
Good evening, everyone. Just going to mention few important points before we start today's panel discussion. You have to rename yourself by following this format. First comes the brief institute name, then the brief department name, and then your full name. Here is an example. If you are facing a bandwidth issue, please keep your video turned off. We will keep you all muted during the session. If you have a question to ask, please write it in the chat box. But while mentioning the question, please make sure that you write who the question is actually addressed to. Means you have to mention the name of the panelist and then mention the question. And the question and answer session will take place at the end of the session. If allowed to speak, please be mindful of the time. Keep your comments brief and to the point, and be respectful of others' opinion. We are also recording this panel discussion. There is also a special note for the FCCU faculty. We need your institute name, department name, and full name. So please rename yourselves accordingly. We need these details so that we can properly record your CPD ORs, and FCCU faculty will also get a certificate of participation. Thank you.
Welcome back, ladies and gentlemen. Before we begin, I would first like to thank our partners who helped us organize this event. I would like to thank the CLT FCCU department, the Population Council of Pakistan, and especially the UNFPA this panel discussion. Uh, just to start things off, what we did or what our team at PRC did is that we reviewed a bunch of articles.
You're muted, Dr.
I'm sorry, let me just restart. Before I begin and formally begin this panel discussion, I would like to thank our partners in this event. Our partners were the CLT FCCU and the Population Council Pakistan and the UNFPA. And without the help of Population Council, UNFPA, and the CLT, we would not have been able to organize this event. Before we actually begin, what our team basically did was we reviewed a few articles that had been done in the last 6 months on COVID-19, and we prepared sort of a brief, which is like a problem statement to set everybody off, and it is pretty much related to what the speakers are going to talk about later. So I'm just going to read that brief very quickly and then hand over the mic to the speakers. Uh, the world is in the midst of a second wave of COVID-19. As the world braces itself and prepares to deal with this new wave, demographic research and methodological tools can help us understand and compare the patterns of transmission, incidence of mortality, inadequacy of health systems, and the impact and economic and social implications of preventive social distancing policies across different countries and regions. In terms of transmission, mortality research has shown us that later adults, especially males, uh, people with chronic illnesses, other vulnerable groups like religious, racial, and ethnic minorities, and people living in economically deprived areas and urban populations are more at risk. Cross-country comparisons show us that industrialized countries and countries with higher population levels are more at risk. Interestingly, the impact of countries with warmer climates and high population density on the spread of disease, which is basically a characteristic of global warming. Treatment of the disease has been a global challenge as local health systems in both resource rich and resource poor countries are strained and have in some cases completely collapsed. Research has also shown that the prevention and suppression of the epidemic is in part possible with large scale social distancing. However, these policies have not been equally followed across countries and regions, and the evidence of their impact on the epidemic and its spread varies. Moreover, these policies are bringing profound effects on communities by severely influencing individuals' lifestyles and behaviors. This, in some cases, has led to further marginalization of vulnerable groups like people living below poverty line, people dependent on state welfare systems, and vulnerable groups like religious, ethnic, racial minorities, and later adults. Lockdowns also have had severe economic implications for countries, especially countries in the global south. And the interventions currently being contemplated in different countries in an attempt to mitigate the effects of social distancing policies on economies are likely to increase inequalities within and between countries, especially between rich and poor countries. However, such comparisons are difficult as the spread of the disease, adequacy of testing and treatment capacities, and social and economic consequences are difficult to estimate due to scarcity of data. The purpose of today's panel discussion is to understand the demographic impact of COVID-19 from a cross-cultural and cross-disciplinary perspective. Some of the themes that we will be dealing with in this discussion are the significance of multidisciplinary inquiry to understand the economic, social, and political challenges emerging from this ongoing crisis and their impact on the lives of people in different parts of the world. Special focus will be placed on the developing world where meager resources and inadequate physical and social infrastructure impede reliable scientific inquiry, policy formulation, and implementation. Having framed this issue or the issues to be discussed later, I will now briefly present the agenda and introduce our chair, co-chair, and the panelists. The event will be chaired by Dr. Zeba Sattar. She is the Senior Associate and Country Director of Population Council, Pakistan. Dr. Jonathan S. Adelton will be the co-chair, who is the worthy rector of Forman Christian College, and he will also deliver the welcome note. Dr. Li Wen Jiang is our first panelist who will speak. He's Senior Associate, Population Council, New York, and professor and founder, director of the Asian Demographic Research Institute at Shanghai University. He will talk about COVID-19 solutions across the US states. Our second panelist will be Dr. Feng Guishi, Associate Professor at National University of Singapore. He will talk about the impact of COVID-19 on the population, especially the most affected age bracket, which is later adults. Our third panelist is Dr. Leo Van Wijzen. He's Director and Professor of NIDI at the University of Groningen, Netherlands, and he will talk about COVID-19 and demography from a European perspective. Our fourth panelist is Dr. Ghulam Muhammad Arif. He's the former Joint Director of PIDE Pakistan, and he will talk on understanding the social and demographic impact of the COVID-19 crisis in Pakistan and the broader implications for the developing world. Our last panelist, Dr. Gavin W. Jones. He's Emeritus Professor, School of Demography, Australian National University, and he will talk about COVID-19 and reproduction. As you can see, we have a lot of illustrious panelists, so I will just simply jump into the first part of the program, which is inviting Dr. Adelton to deliver a welcome note. I'm going to invite Mr. Jawad Tariq, who is the coordinator of PRC, to please invite Dr. Adelton. Thank you.
So should I go ahead?
Yes, sir. We actually had if I may, there is some technical difficulty there. I would just like to briefly.
All right, let me just write.
Yes.
Greeting, ladies and gentlemen. My name is Jawad Tariq, and I'm coordinator of Population Research Center and an assistant professor in Department of Sociology. I feel great pleasure and honor to introduce the co-chair for today's session, Dr. Jonathan Adelton, the rector of Forman Christian College at Chartered University, Lahore, Pakistan. Dr. Adelton is an academic, he's a researcher, he's a development expert, he's an author, he's a philanthropist and a retired civil services officer. Born and raised in Pakistan, Dr. Adelton is a graduate of Murray Christian School, Pakistan. He has a BSc in journalism from Northwestern University, Illinois, and a PhD in international relations from Tufts University, Massachusetts. A five-time USAID mission director, he has also served as US Ambassador to Mongolia and USAID representative to the European Union. As a USAID mission director in Islamabad during 2006 and 2007, he headed the USAID-funded reconstruction efforts in northern Pakistan following the 2005 devastating earthquake in Pakistan. Dr. Adelton, following his retirement from foreign services in 2017, served as adjunct professor at Mercer University and executive director for American Center of Mongolian Studies. He has many notable publications. Some of his famous books are Undermining the Center, The Gulf Migration in Pakistan, Far and Distant Place, Mongolia and the US, A Diplomatic History, The Dust of Kandahar, A Diplomat Among Warriors in Afghanistan. I would now welcome Dr. Jonathan S. Adelton to give us a welcome note.
Thank you. Thank you very much for that kind introduction. I really do appreciate it a lot. It's wonderful to be on this panel as well. Dr. Zeba Sattar and I were talking a bit earlier that we've actually go way back. and then also to connect with my Forman colleagues and actually make this the first webinar since arriving only a couple of weeks ago and taking this assignment. So thank you, Dr. Vaca, for making that possible as well. I did want to say just a few things just to start it and that are sort of in keeping with the theme, and many aspects about this interest me, certainly the demographic one, but also the cross-cultural and cross-disciplinary aspects of it. And although international relations is perhaps not on the list in the immediate sense, it actually has more of an effect than you kind of might imagine. And I was just going to briefly say that in my teaching at Mercer University the past 3 years, one of the things I would talk about were the hinge points in history in international relations between countries. And of course, you'll be familiar with them in the IR sense. You go back to the Treaty of Westphalia in the 1600s or the Concert of Europe in the 1800s. More recently, the World Wars, the end of empires, the age of decolonization, or whatever. Interesting in my own foreign service career, 2 hinge points. One was the end of the Cold War, and the other, of course, was 9/11 and what happened afterwards for the next decade, as you know, influenced the world in so many ways. Public health issues don't usually get to the status of hinge events, although if you look back, you'll think about the Great Plague, certainly in Europe, would count as a hinge event. And looking sort of ahead, I wonder if COVID-19 may be looked about that in certain ways, in the way it's global, in the way it affects countries, and it affects international relations between countries. So again, thinking about the subject today, in a narrow sense, it's important, but in a broad sense, it may be bigger than people realize. The other thing, and to make it perhaps more personal, is that earlier this year, our son-in-law, who's getting a PhD in biochemistry in Canada, he's actually working on, one of the things he's working on is, with a grant from Canada, is ways to test. And of course, that's so important to COVID-19. But the interesting thing for me is that he kind of delved into other areas, wrote a series of popular articles early on, and made the comment that one of the things in this pandemic that may be different is that most pandemics, and I think he was thinking of influenza, it's the very old and the very young that are especially fall casualty early on to what's happening. And he made the point that as bad as this is, so far it's not the very young that are included in it. It was an interesting observation. I posted some of his perspectives on social media like people do, and I got my great response from Farouk Mangera, a friend, obviously family origins in South Asia, but has lived for generations in South Africa. And he said, my first degree was in epidemiology. That's an interesting article. It's relevant to South Africa. So here's again, a sort of Canadian story being conveyed to South Africa via Pakistan. And I will say, and you have seen it in your own circles, where I come from in the States, there's been some skepticism about some aspects of what's happening. It's fed on social media. And so you get these sort of views, everything from the skeptical to the panic-stricken. And the saddest aspect of this are those who I've seen on social media who start off skeptical and end up panic-stricken or even terrified. And just to watch this happen over the months, that know nothing to worry about, why wear a mask, what's the problem, what's the issue, and just to see that unfold. I guess the reason I say this is I think it underscores the human dimension and frankly, the heart-wrenching human dimension of much of what we're talking about. So again, I love the fact that we're gathering together. I love the international aspect about this. I mean, just think among the 60 people here, we have Pakistan, Australia, Netherlands, Singapore, the US, and maybe some other places as well. To me, that's pretty amazing. And again, the purpose, looking at demography, looking at international aspects, looking at the developing world, all that's part of the discussion. So I'll end it there. And again, very pleased that I can participate, very appreciative that this is my first sort of public event, if you will, at Forman, but knowing that I'm going to learn a lot in this conversation. And again, turn it over, I guess, maybe to Dr. Sitar or to the next speaker here.
Thank you, Dr. Edelton, for the inspiring words. I would now request Ms. Khizra Nasir to introduce our first panelist for today's session.
I do apologize for the delays. We're having rain right now. It has suddenly affected our internet connection. So we do apologize for the inconvenience.
Hello, everyone. My name is Khizra Nasir, and I'm a research assistant at Population Research Center, FC College. I would like to invite our first panelist, Dr. Liwin Jiang, for his discussion. Dr. Jiang completed his PhD from University of Amsterdam in demography. He is currently working as a senior associate on the Population Council's Poverty, Gender, and Youth program in New York. He is also professor and founding director of the Asian Demographic Research Institute at Shanghai University. His research focuses on integrated assessment of population, environment, and climate change. He has also taught at Brown and Peking University. Dr. Jiang will talk on how COVID-19 may affect population distributions across the US states. Dr. Jiang, could you please proceed with your discussion?
Thank you very much for the introduction. Thank you very much again for inviting me as part of this very important event. I'm now going to share my screen. I don't know if can you see which one of the
We can see your slide, Dr. Jiang.
can see my slides. It's all the slides, also including some other parts of the node. Okay, maybe.
Yes,
I think if you can put it on full screen because it is showing your notes.
It's not the full screen, right? Okay.
No, it's not the full screen.
No.
I think now is correct, right?
Yes.
Now
yes,
it's full
it's
screen.
good.
Thank you.
Thank you very much. So COVID-19, the coronavirus pandemic, has profoundly changed our society. It not only generated severe effect on human health, but also caused damages to the economy, education system, changed our daily life and social behavior, which leads to major effects on demographic events, including not only mortality, but also fertility and migration. The effect is not only a temporary shock, but could also be long-term. So it will affect the society and the human population. Demography can help understand how the pandemic has spread and how it affects people by different characteristics and locations, and what are the short and long-term effects would be on the society and the population. Of course, the future impacts you can see will show up from the statistics, but demography has the tools and the models and the methods to well predict what could happen in the future. So the objectives of this research is we have two objectives. The first one is try to understand how COVID-19 affects demographic behavior, including fertility, mortality, internal and international migration, and their population changes in the 50 states of the USA. And we also simulate the impacts of a pandemic crisis on future population structure and their social economic implications. So the model we used for doing this work is a multi-regional population demographic projection model. This is a multi-state demography based on multi-state demography. And we take advantage of our recent work on the subnational population projection, just finished quite recently, published in Environmental Research Letters. So we also collected data from all the official data sources, except the SafeGraph data, which is collect records of, which collects all the records of mobile phone users and to measure the mobility changes before and after the pandemic outbreak. So for the time's sake, I'm go directly to look at those data and show some of our analysis. To measure the impacts of COVID-19 on mortality, the US Center for Disease Control reports the number of deaths for each state. For the whole country, there has been already 255,000 COVID-19 related cases. The number, although differs substantially across 50 states. This graph shows the proportion of COVID-19 excess death to the death of all causes in 2019. The blue bar is based on the recorded number by November 17. The dark red bar is the low estimate. The light red bar is the high estimate. As you will see, in almost all the states, the recorded number, which is in blue bar, has already passed the low estimate. And in some states, including Massachusetts, Rhode Island, and North Dakota, the recorded number of deaths are now bigger, even higher than the high estimates. So we also find that the age and gender profiles of mortality rates related to COVID-19 is about the same as the rates of all causes of death. Because of this, we are able to convert the excess death due to COVID-19 to the reduction of life expectancy, which will be used in developing the scenario for our modeling exercise. COVID-19 not only affects mortality, but is also generate important effect on reproductive behavior. Recent survey report that the economic hardship and uncertainty caused by the pandemic crisis leads to delay in pregnancy and reduce the desired family size. One study shows that 1% increase in unemployment rate leads to 0.9% to 2.2% reduction in fertility. This graph shows the percentage points of increase in unemployment rate in different states by late September of 2020 compared to the same period a year ago. The increase of unemployment rate is as low as 0.3% in Nebraska, but could also be as high as 12.5% in Hawaii. In general, the higher the urbanization level, the higher the increase in unemployment rate. Similarly, we use the safe graph data, measure the changes in cross-state mobility. This graph shows the changes in the share of immigrants in each state between 2020 and 2019, after and before the COVID-19. We see a large decline in the share of immigrants in New York and New Jersey, but the share increase in other states, in many other states. The change is selectively correlated with the urbanization level of the states. Therefore, it seems that more people are now choosing to leave the cities and densely populated urban areas to less populated areas under the pandemic crisis. So the question is, will the COVID-19 lead to new wave of counter-urbanization? So maybe not. But this change could last for a very long time. And how long it will last this is uncertain. To account for the uncertainty, we developed 3 scenarios to study the impacts of COVID-19 on population growth and distribution across all states. We assume a low impact and a high impact of COVID-19 only happen in 2020. Our study will predict that by the end of the year, the pandemic lockdown could generate some major impacts, not only for fertility, mortality, and internal migration, but also on international migration. Because studies predict that by the end of the year, the pandemic lockdown will lead to as high as 56% reduction in international migration to the US. We assume that the international migration will reduce by 25% in 2020 under a low impact scenario, and by 50% reduction under the high impact scenario. We also look at the potential longer term impact of COVID-19 by developing a long impact scenario. We assume fertility, internal and international migration will take 10 years to get back to the normal level. In the long-term impact scenario, we do not make the similar assumption for mortality, because we know now the vaccine is on the way. So we put all the data and scenario as input for running the multi-state, multi-regional population projection to get the results. We quickly report some of the modeling results. This graph shows that the US population may experience a major, maybe the largest population decline over the past century. The total population may reduce by more than 500,000 because of the COVID-19, which is much bigger than the reduction caused by Spanish flu, the world wars, and the depression in any single years. However, the US population will resume to grow even under the longer term, which is in the red, right? Longer term impact scenario. So although the national population may experience a major decline, the decline will only happen in a small number of states with a large population. For instance, New York, Florida, and also California under the high impact scenario. Most of the states, which is in green, right, will actually continue to grow. For example, the second largest state, Texas. If we look at the net impact of COVID-19 on population changes, COVID-19 will lead to population decline for Texas. It is just because the force of population decline caused by COVID-19 is not as big, is not big enough to cancel off the forces of population growth. So then you still have the population growth, right, in Texas. On the other hand, the COVID-19 will lead to population growth in states like Vermont because of receiving internal migrants from New York and Massachusetts, while the fatalities caused by the virus is very small. And the impacts of COVID-19 on population is not only on the population total size, but the COVID-19 will also affect the population structures in the future. 50 years later, when we look at the population pyramid of Utah, the impact of COVID-19 will be reflected by the smaller size of a population aged 50 right here, which will generate an echo effect to the population growth, population changes in their children aged 25 and 30s in 2070. This type of echo effect will not show up in New York, even under the long impact scenario, because population growth in New York will be mainly driven by migration, not by fertility like in Utah. So this is something like, demography can tell you what could happen in different states with different socio-economic, demographic, economic conditions. So that's the mainly report of the work. And the conclusion is that COVID-19 will generate a profound effect on human population and may lead to significantly population decline in the US. But the the changes will substantially differ across different states. Demography can make important contribution to understanding the spread of the COVID-19 and their impacts on human society, can offer useful information for the intervention policies and socioeconomic planning. With that, I thank you for your attention. Thank you.
Thank you, Dr. Jeng, for your informative discussion. Now, I would like to invite our second panelist, Dr. Feng Yushi. Dr. Feng is an associate professor from the National University of Singapore, Department of Sociology. He recently received the Award of Excellent Researcher. He completed his PhD degree from Duke University. He is the steering committee member of the Center for Family and Population Research in National University of Singapore, External Research Associate of East Asian Institute, and Honorary Research Fellow at Shanghai University. His research fields include aging and health, population studies, and economic sociology. Dr. Feng will talk on the impact of COVID-19 on the population, especially the most affected age bracket, later adults. Dr. Feng will also discuss the implications for understanding the impact of the pandemic on the population in the developing world. Dr. Feng, could you please proceed?
Oh, thank you. Thank you, Dr. Tarek. Can you see my slides? Sorry, can you see my slide? Yeah, thank you. It's truly my pleasure to participate this this conference, and I would like to. I learned a lot from Professor Jiang's presentation, which is mainly about a projection model about how COVID-19 has been affect different demographic events. I think my presentation will focus on a segment of this population changes. That is, the older adults. I would like to generally mention about the uniqueness of COVID-19 in affecting our society. COVID-19 is a very special virus because of its unique combination of fatality and then transmission capacity. In terms of fatality, it is definitely lower than the SARS and MERS. However, in terms of transmission capacity, it is estimated to be higher than the seasonal flu. And that's why it created, a very special situation for the human society to respond to this major crisis. According to my own research with Dr. Danan Gu and Ms. Lu Siyao, we kind of accumulate international data to see which part of population has been most affected by COVID-19. And these are some of the data we get, statistics we get. As you can see, elderly people has been explained a big part of the infected cases. And in particular, for the mortality part, for the death cases, around about 80% to 90% of the death cases are from the people who are very old, age more than 60 years, or even 80 years. So I think with those evidence, we are trying to argue that older adults are the most susceptible and vulnerable group in this pandemic, with much higher infection rate and mortality rate than the other younger age groups. And specifically, this is the statistics we observe from Italy. As you can see, so the weekly death count are mostly come from the age group over 60s. And very, very rarely people die, in a young age, but most of them come from the old age. And this phenomenon has been realized very soon. According to our literature search, we see for COVID-19 infections in the published papers, one of the major themes, appears to be aged 60 and over. So it's obviously that we have already recognized COVID-19 has been highly associated with a very special age group, which is the older adults. Not only that, I would like to see gender also play a big role. According to most of the country's statistics on COVID-19, we find a very significant gender disparity of infection and mortality. A man have more risk than women in this pandemic. So that's the general age and gender pattern. Looks like older men are the most vulnerable group in this pandemic. However, I'm from Singapore. I would like to mention Singapore is this kind of general pattern may not be applied universally. For Singapore, this is the incidence, statistics for COVID-19 in Singapore. As you can see from the Singapore story, most of the confirmed case actually are not from the older adults. Most of them are concentrated in the age group of 25 to 34. And this is because, the Singapore COVID-19 story is a very special one. At the very beginning, Singapore take, very strict measures to control the spread of this virus. It was quite successful, actually. However, since the March of this year, the migrant worker, dormitory became the focus of the spread out of COVID-19. And that's why we see this surge of infection cases from the very young age group. But I should say Singapore is a very special case. In general, elderly people are more vulnerable in terms of infection and mortality rate. I want to discuss a little bit about the social, biological, and psychological reasons about why elderly people are more vulnerable in this pandemic. Biologically speaking, the immunization, the immune functions of elderly people actually declined with the advancement of age. Their lung function is also proved to be poorer than the young people. particularly one of the major pathway for the infection of COVID-19 is the ACE2 receptor, which was found to be more prevalent for the lungs of older people in comparison with young people. And then in regard with the very high mortality rate of the elderly people, many of the older people, pass away in the COVID-19 infection exactly because they have the comorbidities. They have already got chronic diseases, and the COVID-19 infection actually exaggerate the symptom and leading to the mortality. And according to our own study, about 90% of the Chinese older people aged 65 and over got more than one chronic diseases. And that means, the comorbidity were quite prevalent among the old people. And that's one of the major reasons explaining for the high mortality. And also, we think the malnutrition, which is highly linked to the immune system, could be an explanatory factor for the mortality rate. Even in America, about 16% of older people take in less than 1,000 calories per day, which is under, the nutrition, the good nutrition standard. And then last, we think because of the cognitive impairment of older people, and there might be more misdiagnosis and a misdiagnosis in finding the case of COVID-19. Elderly people, the body might respond to the infection slowly. And also in the epidemiological investigation, older people sometimes could not remember clearly where they go. And that add to the risk of to be misdiagnosed. These are all the more of the biomedical perspective. We also think the social psychological perspective, are equally important for us to understand the disadvantage of this group. First of all, ironically, receiving care of elderly people could become a very big risk factor of these older people in the pandemic. The contact with social workers, the need to go to the hospital, or even the care from the family members could become a source of infection. And more importantly, many elderly people in our world are living in the disadvantaged social economic status, the poor housing condition, and then the less resources to deal with the pandemic may be the reason for them to be more vulnerable in terms of infection and mortality. And information is very important for elderly people dealing with this pandemic. But elderly people usually have the digital gap. Many of them do not own a cell phone, or even do not, even though they have cell phone, they don't know how to use it to access needed information. That might make up a reason explaining for their disadvantage. Also, elderly people away from economic life and have a reduced, more isolated social life. And this kind of lifestyle and also could increase their stress in daily life. And that might incur many, many problems in their daily life. And that's why they are more disadvantaged in this pandemic. And lastly, I would also like to mention, in some countries, there is some very obvious ageism in dealing with elderly people in this pandemic. For example, in some countries, when the medical resources are limited, and usually the priority will put on children and young people, but actually sacrifice older people. And even worse, in some social media, and this pandemic has been called the baby boomer remover. And this phenomena is very bad, and it's kind of like cultural reason, explaining debate, the situation of older people in this pandemic. Additionally, we also think the gender disparity in this pandemic are also partially explainable by the biological reason, because men and women have different immunological features, and also part of the reason could be because of the social and behavior, characteristics. Obviously, men smoke more than women in older age. That could be partially explaining why men are more disadvantaged in this pandemic. I want to explain, mention some experience from China, uh, you know, uh, as good experience, to fight against COVID-19. Uh, I have a link here, which lists all the major policies by the Chinese COVID-19 national agencies. Uh, Through these policies, it is quite clear that at the very beginning, the Chinese government got a focus on the elderly people. Firstly, they pay special attention to the institutionalized elders. And later, it moved to the solo living, empty nested, and left behind seniors. And later, they start to focus on elder people with mental illness and elder people with care needs. I think these age-specific policies could make up one of the major reasons for the Chinese to successfully fight against the COVID-19 so far. But I think the Chinese story, just a little bit implication of this. I do think this successful experience of China should be further expanded to all kind of policy domains in regard to taking care of elderly people, because the aging has become the national top fighting against the population aging issue has become the national top strategies of China in the last months for the Chinese the state council's document. For the very first time, taking care of older people, building an age-friendly society become the national top strategies. And just this week, actually, there's a very interesting news in China. China start to have this online finance. Usually facial recognition become required by the Chinese government and then the banking system. And this poor old lady is 94 years old. In order to recognize her face, the bank asked her to go to the banking branch in order to to capture the image of her face. And this soon become a major news. People blame that this is so inhumane that you move a so old lady to the bank branch to take a picture. The banking system should go home to take the picture. And then just last week, the Chinese State Council issued this document saying we really need to take care of older adults in using the IT and the internet, to try to address these issues. And at the very last, I want to say population aging in this COVID-19 has become a risk factor. This could be historically the very first time that we realize population aging itself could be a risk factor. So how to how to address this issue? I hope to say this probably not only a population issue, but a family issue. Not only we have more elderly people, but more of our world older adults are living without any children. This is our projection. You can see in China, many older people, not only old, but they are living without any children. So we call for more research in this regard. And we think now has been never a better time to study the future of China, especially affected by the issue of COVID-19. Thank you very much.
Thank you, Dr. Feng. It was an honor for us for having you as the guest speaker. Now, I would like to invite our third panelist, Professor Dr. Leo van Wijzen. Dr. Leo is the director of Netherlands Interdisciplinary Demographic Institute. He's also a professor of economic demography at the Faculty of Spatial Sciences at the University of Groningen. His research interests include demographic modeling and forecasting, aging, regional population change, spatial interaction, and regional modeling. He has published numerous articles in international peer-reviewed journals on each of these topics and is also a co-author of a number of scientific books. Dr. Leo, can you please start your discussion?
Yes, thank you very much. I will try to get my presentation shared with you. Hopefully this will work, because I get this screen for some reason. I'll try the other one. 1 second, sorry for that. This one. It still happens like that. Well, is it okay to see these pictures like that? I mean, you see what's happening, right? It should be a full presentation on the screen, but for some reason, it refuses to give the screen that I was thinking of. Can you understand me and hear me well?
Yes, Dr. Wazin.
All right. Okay, well, first, I thank you, and I'm honored for the invitation to participate in this panel. Well, I've just seen two very interesting presentations, and I hope that my presentation will somehow meet the expectations to some extent raised by the first two presentations. And I think also this meeting is a good example of how every disadvantage, like the COVID pandemic, has also some advantages, because this Zoom meeting is very international, as we noted at the beginning. And people from different countries are easily able to collaborate with each other and to share their research results with each other. I think that is a new platform for the future to make much more use of as well. So that's something I think to cheer. My presentation was sort of put in the agenda as the European perspective, but I must be more modest than that. It's basically mostly about the Netherlands as a sort of a European case study. But many things of the Netherlands will also fit in the European framework, although there are many differences as well. Okay, let's see how this is going to work. Yeah. Okay, so COVID in the Netherlands, a demographic perspective. And I will focus on a few things. First, I will give you the experience of the Netherlands in terms of what has COVID done in terms of demographic consequences. And second, what is the nature of demography as a discipline to contribute to the knowledge on COVID. And of course, we have seen already two examples of that. I would like to add some new perspectives as well to that. Well, as we know, we have millions of experts on the pandemics around in the world. In my country, 70 million people around. I think we have 70 million experts as well who follow daily the news about the new infections, the new admissions to hospitals and so on, and everyone has a sort of an opinion about it. So the knowledge is there to some extent, but we have to also to make clear that from a demographic perspective, we are lacking a lot of knowledge still. So it's growing, the body of knowledge, but there will be material for years to come to study in terms of what was the major factor, what are the major factors for the spread of the disease, the difference between contagion and fatalities and so on, the inequalities among different population groups. We still don't know a lot about these things. But if you ever thought that you could not make a difference in the world, well, it might have started with a simple bet. And whoever said one person can't change the world, he never ate an undercooked bat, because that somehow must have started somewhere. And it has these results. worldwide, it really is a global development. And here you see how the pandemics spread over the world since earlier this year. And indeed, you can't say that it has not reached the major parts of the world, although clearly some regions of the world have been affected much more than others. And these regions are clearly the most connected regions in the world. Mobility, worldwide mobility is a strong factor. And second, indeed, the major centers of population density are there. So it's China, it's partly India, it's Europe, it's the US, much more than Africa so far or Latin America. Well, we have to study as demographers to see what is really the impact of the pandemics. And this is an example of the incidence, the proportion of COVID-19 cases notified in Italy, I think in September, by clinical status and age group. The green area is those who have been affected by COVID without any symptom, which is the majority even in all age groups. Although 80, 89 is a little less so, but still it is a strong feature that many people, even at older ages, are not affected. On the other hand, severe and critical symptoms are mostly indeed, as also already been said, and of course clearly known, beyond age 60. But it is, an infection is not by definition a fatality. Some are very critical about the way the world responds to the pandemics. Here you see an image of COVID infections, the cases and deaths by week, a 7-day rolling average. You see indeed the first wave in March, April was severe for the Netherlands. But now in the second wave, lots of infections, but very few fatalities so far. We have learned quite a lot by now already to even after infection and even after hospitalization, to deal with it much better than in the first wave. And indeed, the difference between infections and death, the ratio between the two is much different now in the second wave than it has been in the first wave. But clearly, because of the experience of the first wave, the sort of the panic or the concern about what would happen with the second wave is clearly is there. Yes. Well, how does the second wave in the Netherlands compare to the first wave in terms of confirmed cases? Here you see how the black line in terms of confirmation is bigger now in the second wave than in the first wave. That is because we have much more testing, and the uncertainty in the first wave was much bigger, as you can see around the other. The mean estimate of the number of infections is here, and this is going up again in the second wave, but the second wave is very much less in terms of estimate of people infected than the first wave, although it's going up. And indeed in the Netherlands, as in many other countries in Europe, and also not Europe, but also in America, it is very difficult to sort of get the curve down again. It's going it sort of stabilizes in my country a little bit over the weeks, but it's very difficult to get it down. Well, in terms of how bad is it, you could compare the COVID pandemic with the flu pandemics of the past 10 years. And here you see was a big flu wave in 2013, leading to more than 6,000 deaths. again in 2015, then a smaller one in 16, another one in 17. In 1918, we had a big one that went more or less unnoticed, but created lots of problems in hospitals, and even hospitalization and admissions to intensive care units were close to, in some regions, close to what happened with COVID, although it didn't make the news at all at the time. We had about more than 9,000 deaths because of the flu 2 years ago. Now we are in 2020, and the estimate of the excess death is around 10,000. Maybe it might be 11,000 by now, which is bigger than the flu of 2 years ago, but not an order of magnitude bigger. So in terms of the peak, it's sort of broadly comparable to the influenza peaks of the last couple of years, a little higher, but of course, at the cost of closing down whole society. That must be said, because we didn't close down society. We didn't have a lockdown 2 years ago with the flu. Life went on, and we accepted more or less unnoticed that, well, the flu is there and people die from that. Now it's quite different. We had a lockdown and a second lockdown with a second wave, which keeps the number of deaths indeed at a level that the sort of the medical system is able to cope with it. But it is at the cost of well, a societal sort of emergency stop, in a sense. So we have to take this very much into account. But then, what are the demographic consequences of the pandemics? Well, I go through a few components in the Netherlands. And of course, you think firstly about mortality and, well, life expectancy. If you look at what happened, the first two bars are the life expectancy of males, the blue one, and of females, the red one, in 2019, which was 80.5 for males and 83.5 for females. That was a normal case last year. The estimate of the COVID pandemics in 2020 leads to a reduction of the life expectancy by, you could say, half a year. Both for males goes down to 79.9, and for females goes down to 83.1, which is basically half a year reduction in life expectancy. If you compare that to the effect of the influenza, the flu, 2 years ago, that came close to the COVID effect, 80.1 for males and 83.0 for females. So broadly comparable, but slightly different, although same order of magnitude as COVID. You could conclude there is an effect, a decrease in life expectancy, but we already experienced some decrease in life expectancy a couple of years ago, and already a stagnation of life expectancy increase due to the flu waves of the last couple of years. And if you think of the sort of the longer term developments in life expectancy, we know the very famous graph made by Vaupel and John Oppen, starting with 80-40, a sort of a almost straight line of increase in life expectancy in the last couple of years, not only because of Corona, but also the flu epidemics. It has stalled in many countries and even started to decrease a little bit. So the COVID pandemic sort of fits a little bit in this influence of epidemics or pandemics on the increase of life expectancy. And the question is, of course, what will it be for the longer term future? We don't know, of course, at the moment. So this is life expectancy. Well, you can see this in terms of total number of death and birth and death in the Netherlands. This starts at 2018 by month. And you see the big peak here is the excess death due to COVID. The number of births, well, of course, we can't see that yet because if there's an effect, it will show in a couple of months from now. And we don't have any indication at present of people becoming less pregnant because of the COVID pandemics, or more pregnant could also be the case, of course. So the case of the US, where you link, as just shown by that one, of the birth connected to unemployment or economic conditions, could be the case here as well, that the expectation might be that there will be less birth because of the economic uncertainty. But you see that in terms of the death, there is a peak of death in the period of March to May. It went down, and the strange thing is we had sort of a shortage of death thereafter. This period was less than expected number of deaths in around June, July, meaning that these deaths were sort of selective. The frail people, elderly, were victim to the pandemics, and that led to sort of less death than you might expect in the season afterwards. It's going up a little bit now, but as I showed you just before, the number of excess death at present is very limited in the second wave, so far. Okay, in terms of migration, also sort of pointed to in the US case by Lewan, migration here, we should look at this part of the curve. We see indeed in terms of immigration a stark decline, much bigger than other years. So you may say that immigration, but also emigration, dropped by about 20 to 25% in these months. It has gone up again since then, which is similar to other years, the peak here, because that's the summer period where these numbers go up a lot. Students entering the country, new labor migration figures starting after the summer holiday. But the peak here should have been normally this peak. So you can say, well, it's again, it goes up, it's seasonal effect, but the total effect is in the order of magnitude of 20 to 30% less than normally would be the case. This means that in terms of total population growth, starting here at 2018 again by month, we see here that in some months we had negative population growth, although it has increased again now to levels which are lower than in previous years. But for the total period of 2020, I don't expect population decline, although sort of 20 to 30% less growth than we would have expected based on our projections. So these are the first sort of effects, clearly visible effects of the pandemics on the demographic components in the Netherlands. Another interesting discussion is what will be the effect on internal migration. There are lots of hypotheses or expectations that people start to see the advantages of working at home, as we do now by Zooming. Otherwise, we might have been invited to Islamabad and be there in person. Mobility is clearly reduced, and maybe on a structural level, meaning also that people start to rethink their place of residence. We might get away from the big overcrowded cities and move to the countryside where we can work easily and at leisure by using Zoom or Teams up or whatever, and maybe go to work 1 or 2 days a week or something like that. Is that visible in the Netherlands? Do we sort of really need a sort of a new spatial pattern model for the future? People moving away from the center. Well, if you look at total internal migration, it has been a little lower indeed in the last couple of sort of half year to 8 months than in other years. I think again 10 to 20%, but I don't see a big flow. I can't show the figures here in detail, but if you look at it by region of the country, the rural or the urban region, it more or less is across the whole of the country. And another indicator is that the housing market in the Netherlands is still very much it's still a very tense housing market. So there is still a high demand for housing. We don't see any signs of sort of reduced tensions in the housing market. So far, that goes for urban as well as rural areas. So we can't say that it's the very early sort of indications, but we can't say that there is a big effect in terms of location choice of people across the country so far. Maybe it's too early to conclude for that. Okay, then as a sort of, these are sort of examples of how demographers look at the pandemics. I think the key issue of demography is that we look at the bigger picture, the macro picture of population consequences. Other than epidemiologists or whatever who look at more the micro elements or the disease consequences, we look at what does it mean at the population level. And that's, I think, a unique contribution that we make as demographers. And as one example, we had in the Netherlands last week the annual meeting of the Dutch Society for Demography. And it was because of the pandemics, it was all online, but it worked out perfectly. And the theme of the week was the COVID, demography and COVID. And I take out one example of a nice study that I think pictures very well what demographers can contribute to the whole discussion. A study that showed the role of population structures in the spread of the pandemics. The idea was, it's an article by Albert Estève and Jim Vaupel and others, and just published in PLAS in July of this year. If you take from population registers or samples the co-residence patterns of the population in terms of who lives together with whom, then you may infer what is the effect of the age and co-residence structure of the population on the spread of the pandemics. And what they did was they have the structure of the co-residence structure of the whole population in a simulation model. They infected randomly a couple of percent of the population, and that percentage was what was the reality at that moment for the various countries. They did it in an international framework. And then because of the structure of the co-residence in each of the countries, by means of, well, do young and old live together? How many people do live together in terms of persons? If you infect randomly so many people in one population, then taking that everyone, well, you may say different, you could sort of impose different scenarios in there, but suppose half of the other people in the household will get infected too, what happens? Well, this is the result for many of the countries. I think they used for these countries the IPUM's census information, which is stored for many countries. This line is the sort of direct effect of the infections. And the additional line here is what happens because of the co-residence structure. So some countries where most people live alone have little effect of the co-residence pattern, but many countries where people live together and many generations, multiple generations live together, will have big effects of the co-residence structure. This is something that is a very demographic contribution to the whole discussion, and may lead to indeed designing policies that are relevant to impose, to sort of fight the spread of the pandemics. For instance, this structure explained why the infection rate initially in Southern European countries, where co-residence of many generations is very normal, was much more severe than in Northern European countries, where most people live just among themselves, single people living alone in a house, or with 2 or 3 people, which makes the effect much smaller. So these types of analysis are very useful and are very typical for the demographic perspective on the whole process of the COVID pandemics. Okay, thank you very much for listening to my small and modest contribution.
Thank you, Dr. Leo, for sharing this valuable information. Now I request Mr. Daud Rafiq to invite our next panelist. Thank you.
Hello and welcome all. My name is Daud Rafiq and I'm Research Assistant at Population Research Center, Forman Christian College. I would like to introduce our next panelist, Dr. Ghulam Muhammad Arif. Dr. Arif has completed his PhD and master's degree from Australian National University, Canberra, in the subject of demography. He is a former Joint Director of Pakistan Institute of Development Economics. He has also served as Dean of Research, Senior Research Demographer, Staff Economist, Associate Staff Economist, and Research Associate at PIDE. Sir, could you please proceed with your topic?
Bismillah ar-Rahman ar-Rahim. Just for a minute, let me show these slides and can you see the slides, please?
Yes, sir.
Yes, sir.
Maybe you could do full screen, Dr. Arif.
Full screen.
So you can press F5 and that will take you to full screen.
Bismillah ar-Rahman ar-Rahim. It's okay now?
It's still low. We can hear you, sir.
Screen is okay? Can you see on the screen?
Yes, we can, sir. If you can press F5, then it will be full screen.
F5.
Yes, sir.
Sorry, ji. I think now it's a full.
It's full screen now, sir. Thank you.
Bismillah ar-Rahman ar-Rahim. First of all, let me thank you, FC College University, for giving this opportunity to share views on this important topic. I will be discussing the impact of COVID-19 on overseas migration and return migration from Pakistan. Not covering the mortality or the other aspects, is the primarily related to economy and employment issues. What can we see in the case of Pakistan? Little bit I will touch the other South Asian countries' experience as well. Let me say in the beginning, Professor Edelton, our co-chair, is here. I think he has written an excellent book long ago on international migration from Pakistan to the Middle East. And this migration is on for more than 4 decades, 4.5 decades from Pakistan. Suddenly, this COVID-19 had stopped this over-migration phenomenon. And this has serious implications for the society and also implications for the participating household and also for the economy. Just a couple of days ago, State Bank of Pakistan has released its annual report, and it has a special section on this report giving warning about the forced return migration of Pakistani workers who are currently working abroad. It is not only Pakistan. Recently, Lahore School of Economics has organized an international webinar where many scholars around the world, they have shared their views. And this return of workers is a very common warning. It is happening and it can happen quite rapidly many other parts of the world as well, like in India, Bangladesh, Sri Lanka, Philippines, Indonesia. Most of these countries, they are getting ready if they face more return migration. So my objective here is that for today's presentation, that how Pakistan has been affected, particularly for these 2 years, in terms of overseas migration and return migration because of this COVID-19. Just to give a brief background, that if you see during last 1.5 decade, population of Pakistan, adult population, I say 15 plus, it has increased by 50%. And labor force of Pakistan has increased by 55%. And this population increase varies across the provinces. It is highest in Khyber Pakhtunkhwa and lowest in Punjab. Same is the case for labor force. I will go through this by province because migration is not even across the provinces. Migration is mainly 2 provinces in one region, Punjab and Khyber Pakhtunkhwa and AJK, and it is lower from Sindh and Balochistan. It is important to see the provincial dimension as well, that how this COVID is likely to affect overseas migration. In this screen, this labor force of a region, of a province, can really be affected through 2-3 factors: the labor force participation rate, total fertility rate, in-migration rate, and migration between the provinces. And again here, this female labor force participation rate is quite low in all regions and provinces except in Punjab. TFR is high in Khyber Pakhtunkhwa and Balochistan, but TFR in all provinces is more than 3, and in some provinces is close to 4. And in migration rate, it is, I think, interesting to see in the COVID context, but I am not going into detail of this internal or in migration. It is about 13% in Punjab and 8% in Sindh, 7% in Khyber Pakhtunkhwa, and 6% in Balochistan. In Sindh and Balochistan, migration is primarily between the provinces, but in Punjab is within the province. I think this phenomena, it means that the population growth, labor force participation rate, and in-migration rate between the provinces, it has impact on provincial labor force participation rate, which we have seen earlier. Now, with this background, just to come to the overseas migration, 2 concepts are, I think you know, 2 concepts are very common in the literature. One is the stock concept, and other is the flow concept. If you see in terms of stock, about 8.8 million or 9 million Pakistanis are currently living or working abroad. More than half of them are in the Middle East and 1/4 in the Europe, primarily in UK, and 15% in North America, primarily in USA and Canada. But more important for today's presentation is about this annual flows of Pakistanis who go abroad for overseas employment. And we see in this slide about 11.11 million people, they have chance to go from Pakistan to abroad for temporary employment during last almost 5 decades. And 96% of this outflows is towards the 6 GCC countries, Saudi Arabia, United Arab Emirates, Kuwait, and other countries of the region, and mainly Saudi Arabia and UAE. So this is the main focus for today and pandemic system. Here you can see the year-wise flow between 1981 and 2018. You can see that the last 15 years quite important. We have been sending workers for more than 4 decades, but last 15 years are quite important, and 2015 was high in terms of outflows of workers. And it declined in 16, but we have seen an increase in the outflows in 2019. But suddenly in 2020, a very small number, only 170,000 people, they were able to go overseas. Now, this graph shows you the provincial share in overseas migration. The top line is for Punjab, and second, our in terms of population share is Sindh, but Sindh, you see it is in the bottom part. And this is the Khyber Pakhtunkhwa, which has much larger share in overseas migration than its share in the total population. And AJK has also a great share. So these are the 3 regions where we have seen large number of migrants, they are going abroad. Now, in terms of the importance of migration, you can see here this second column, that in Khyber Pakhtunkhwa, the outflows during last 7 or 8 years, between 2010, 11, and 17 and 18, they were about 125% of the new entrants in the labor force. It means that the entry in the labor force was less in Khyber Pakhtunkhwa than the people who are going abroad for employment. And also in Punjab, it is quite high, equal to the 46%. But Sindh, I think it might be some typo, is quite low, and Balochistan is quite low. From this Pakistan Demographic and Health Survey by NIPS, what we have seen, this also gives us the importance of migration, overseas migration, that 77% of households in the country, they have at least one member went abroad during last 10 years. But this percentage is about 13 in Khyber Pakhtunkhwa and 18 or 19% in the AJK. It means that every 10th or every 8th household, some of the regions, they have a worker working currently abroad, mainly in Saudi Arabia and UAE. Now, what we were expecting that more labor may be required in the Middle East, but because of this COVID-19, everything has been stopped. Now, in this paper, which we presented in the Lahore School of Economics about 8-10 days ago, what we did was build 3 scenarios that in the context of expected out migration during 2020, what Pakistan could not achieve, or how many people they would not be able to go abroad, and how many people they are likely to come back. Our estimate shows that if there was no COVID, about 0.7 million to 1 million Pakistanis, they would have gone abroad for employment, mainly in the GCC countries. But actual outflows were 177,000, and there's no migration after March, and it is not expected to resume maybe for next 3 months or maybe next 6 months. Situation may remain very close. So in terms of, you can say the pressure on the domestic labor market because of COVID-19, about 500,000 to 0.9 million workers who were likely to go abroad, they have not been able, because of COVID-19, to find the job during this 20 and 20. And in terms of the recovery, or you can say the resumption of this overseas migration, we have developed 3 scenarios. And under one scenario, what our expectation is that in 20 and 21, it means in next year, compared to, you can say, about 0.9 or million people in 2015 and 16, maybe only 270,000 to 400,000 people would be able to go abroad, and then it will gradually pick up in 2022. And even in some people, they are more, you can say, conservative in terms of estimating this one, that our, you can say, assumption may be over, that people maybe, less people may be able to go abroad during next, you can say, 2 or 3 years time. But the second phenomena is that what we have estimated is about the possible return flows of workers. It just very few, look what I remember these presentations what have been made in the LSE and also some of the recent literature, that 2 to 3 million people they are expecting to come back in India, 2 million in Bangladesh. Philippines are also expecting around 2 million people who are likely to come back. That this not sending workers abroad is a one pressure, and the other pressure is that the people who are abroad, they are coming back to put more pressure on the domestic labor market. In the case of Pakistan, our estimate is that between 0.6 to 1.7 million people, they are likely to come back maybe in next 1 year time because of this pandemic or the COVID-19. Here, I think this provincial share of this return migration as percentage of the provincial labor force is quite high for Khyber Pakhtunkhwa, around 6%, and also for Punjab, around 2%. It means that if they are not able to get absorbed in the domestic labor market, then we have one impact of not being able to send new workers abroad. The other impact would be that around 3% of the, equal to 3% of the labor force, they may return back to the country. And most of these return migrants are in their 30s and they need job and situation. I think the economic growth and many others, we know what the situation is after COVID-19. So it's, this COVID-19 may have a serious impact on this domestic labor market because of overseas migration. During this phenomena, we had chance to talk with the few return migrants who returned during this job. They have a lot of worries about their future in terms of getting back their job, particularly in the GCC countries. And the renewal of the visa has become more complex, and there are serious issues for regaining the situation that Pakistan had during the last 1.5 decades. What is the way forward? The final slide. Just 2-3, I think, suggestions, and also what is the discussion in the literature in different parts of the world as well, particularly in South Asia. First is how to control this return migration. I think it is a serious issue, not for Pakistan, but for many other workers, that there is a need to negotiate with the host governments of the GCC countries and also workers as well, that how can we reduce this phenomena of return migration, which can affect a lot the labor sending countries, including Pakistan. The other is the visa expiry issues, and then more issue is the how to reintegrate these returning workers. Many countries, particularly I was going to the research literature, like in Indonesia, Philippines, and Cambodia, Bangladesh as well, they have developed their reintegration policies that when the people come back, if they come back and people are coming back, like already most of these countries, they have received the workers from overseas markets, how they can get back. They hope they can be absorbed in the domestic labor market. Then the second issue will be that if when the pandemic is over, then how this phenomena and what will happen in terms of the future flows to GCC countries and also some new markets in Europe, and there are some news about the Japan and South Korea and some other countries. But one thing is Pakistan is quite serious, and that is that the demand may be about more skilled workers, but we have largely, our migrants are unskilled workers. Then if we could not reduce the gap of the skill level, then we may have you can say, we could not get the job market which used to have in the past. And finally, I think this migration phenomena has a lot of positive impacts in socioeconomic life of Pakistan, but Sindh and Balochistan provinces, they have largely been, you can say, excluded from this overseas migration phenomena. So that may be considered in future as well. Like it means that the return migration, return flows, skill level, and this regional disparity in migration, these are the things which give us a you can say, point to see in terms of the COVID-19. Finally, what I can say that this migration phenomena, which has a lasting impact on the Pakistani society and Pakistani development issues, it is under serious threat because of COVID-19. Thank you very much.
Thank you so much, sir. Now I would like to introduce our next panelist, Dr. Gavin Jones. Dr. Gavin Jones is an emeritus professor at the Australian National University. He completed his PhD degree in demography from Australian National University in 1966. Professor Jones has conducted researches on varied subjects in the field of demography and human development. In recent years, focusing especially on low fertility regimes in Asia, delayed and non-marriage, urbanization issues, and equity aspects of the educational development. Dr. Gavan will talk about COVID-19 and reproductive health. Sir, could you please start your discussion?
Yes, pardon me. I'm trying to, let me see. I'm trying to get my PowerPoint up. Can you see that?
Yes, sir.
Right, okay. Well, look, thank you very much for the invitation to participate in this webinar. When I received the invitation and I saw that there are a number of very distinguished demographers presenting in this webinar, and also that I'm going last, and that put the idea into my mind that I should sort of reserve judgment a bit on what I talk about and see what other people have said and check whether there are any gaps or aspects that perhaps should be discussed in this last session. And but that doesn't mean that I didn't put some ideas together, which I did. But I think I was asked to talk about reproductive health, the effect of COVID-19 on reproductive health. I've got to say that I'm not really going to talk very much about that because it's not a topic that I'm really expert on, and also I think it's a rather difficult one to really isolate what the impacts are. So anyway, let me just proceed with what I've got here, and what I've been doing over recent months, because I've had to talk about COVID-19 in a number of webinars in different places. I've been keeping track of the Johns Hopkins website, which shows the trends in COVID-19 around the world. It tells you the number of cases, the deaths, the number of tests, and everything's there. And day by day, you can follow what's going on, and I've been doing that. And, one of the things I'm doing is looking at different regions of the world. And in this one, you can see the left-hand column deals with Western countries in Latin America. Then we've got East Asian countries, then we've got South Asian countries, and then we've got Southeast Asian countries. And of course, these are deaths per million population. So, among major countries, Belgium's probably the record holder at this point with 1,345 deaths per million. There's a few small countries a bit higher than that, but it's pretty much out on its own. You've got a number of countries in Europe and United States, all with roughly the same death rates at this point. Italy, the UK, Brazil, USA, Mexico, they're all around about 800. And all going up extremely rapidly at this point. The Western European situation, has got fairly serious in the last few weeks. I think, as earlier speakers have mentioned, and certainly a lot of other studies have shown, the case rate has risen much faster than the death rate in recent times. There is always a lag, but we are dealing better with the pandemic, and you would not expect the death rate to be rising as rapidly in relation to the case rate as it did in the earlier stages. Even so, it's going up. The United States is getting 2,000 deaths a day, and that's rapidly climbing and is going to go even higher. Now, when you compare this with East Asia, it is a dramatic difference. Japan 16, South Korea 10, China 3, Taiwan 0.3. South Asia and Southeast Asia are a bit different, and you've got India up close to 100 deaths per million population, but again, you've got Sri Lanka there, only 4. If you look at Southeast Asia, also Philippines and Indonesia are relatively high, and so is Myanmar. But you've got Thailand at 0.9 deaths per million, Vietnam 0.4 deaths per million, and Cambodia 0 deaths per million. I mean, some of these Southeast Asian statistics are remarkable, as are some of the East Asian statistics, and particularly when you compare them with Western countries and Latin America. So what's going on? I mean, how do we understand all of this? And, you know, you've got a lot of theories around about, you know, some people say, well, democracies do better than non-democratic regimes. That's obviously not true, because you can take cases of democracies and non-democratic regimes that have done well and that have done badly. So it's certainly not explained by that. Others talk about tropical and temperate countries. Well, it's worse in cold climate countries which have seriously cold winters, and everyone's stuck indoors, and you know, they're much more likely to suffer high rates of infection and death, COVID-19. And, you know, no doubt to some extent that's true, but, you know, Japan and South Korea are pretty cold places in the winter, and so is North Korea, which, if we believe what they say, have had no cases at all. So, you know, and then you have countries like Australia and New Zealand also, which are doing pretty well. So it's not just to do with tropical and temperate countries. So it really is interesting, I think, to look at this. I've only taken sample countries here. Unfortunately, I don't have the Netherlands. I should have put it in there, since one of our speakers is from there. But, you know, if you look at across Europe, you do have a very wide range from those countries. With I've got Germany and Greece down at the bottom there. But both of them are going up quite a bit. I remember just about 3 months ago, Greece was about 30 per million. It's up to 157 per million. And you see that sort of trend is going on widely throughout Europe at this stage. Now, there are various other statistics that are interesting to look at. And one of them is the percentage of tests that are showing, you know, that there is an infection. That is the percentage of tests turning out positive. Now, I just looked at this for a few countries, and Brazil and Mexico and Belgium, of course, are all doing very badly in terms of death rates. But you can see that Brazil and Mexico have very high percentage of tests turning out positive. Now, what does that mean? Well, it basically means that not very much testing is being done in relation to the scale of the pandemic. And it's tending to be done only in cases where, you know, someone is becoming very ill and then they get tested. And indeed, in quite a high proportion of cases, you find out that they have COVID-19. Now, there's a kind of a rule of thumb in the epidemiological world that if you get down to below about 5%, or ideally below about 3% of tests turning out positive, then you're in a much better situation to deal with the pandemic, because you have a much better fix on what's going on. But of the countries that we're looking at here, the only ones that are below 5% are Japan with 3.8, Australia with 0.3, and Vietnam with 0.1. So if you look at those statistics in the Johns Hopkins website, there is an extraordinary range between countries in the amount of testing being done. And it doesn't always go quite the way you'd expect. For example, Japan does not do an enormous amount of testing. They have low death rates. They also, as you can see, have pretty low percentage of tests turning out positive. But they seem to have very targeted testing in Japan in a way that is not true in some other countries. So I think that these kinds of statistics are very much worth keeping an eye on when we're looking at what's going on. Well, let's turn to the issue, you know, aside from reproductive health and family planning, how will COVID-19 affect fertility? And the answer is not as simple as it may sound. You hear the argument that couples will tend to postpone childbearing or possibly postpone marrying in the first place in the light of serious economic hardship and uncertainty. I just got an email from a former research assistant in Singapore who said she's getting married later this year, but she's postponing the feast, because the wedding feast, because of COVID-19. Now, of course, Singaporean Chinese, you have the wedding ceremony and you have the wedding feast, and they can be separated by many months or even a year in time. And so they're getting married, but they're postponing the feast, hoping that, you know, within a year or so, they'll be able to have a good one. So, but you know, they're not postponing the marriage. How much are people postponing marriages? Well, we don't have very good information. Now, if they did postpone marriages, this would lead to a decline in period fertility, at least for some time. But if we look at studies that have been done on evidence of fertility trends in recessions, that's a slightly different thing. But Thomas Sobotka and Skirbeck and Filipov, they did a paper which showed only small aggregate effects, in most cases not leaving an imprint on cohort fertility levels. So that's worth keeping in mind. But coming back to this issue of marriage and how much COVID-19 is affecting that, there are opposing arguments which you can read about. There are claims that in India there's been an increase in child marriages because families are unable to make ends meet. They seek to marry off their daughters. And Indonesia, there's some actual evidence that it's experiencing a surge in child marriages, apparently linked to increased economic pressure from COVID-19, along with increased religious conservatism. So, you know, in these cases, it would appear that rather than the opposite argument that people will postpone their marriages, that in fact it may accelerate it. And obviously this depends very much on the conditions across societies and between different societies, and it's very difficult to generalize. Okay, how will COVID-19 affect family planning? Well, it will clearly disrupt family planning programs. It will disrupt them in all sorts of ways. And that, of course, is a bad thing, particularly for the more disadvantaged parts of the population that are being served by family planning programs, who don't have, you know, very good alternative means of dealing with the situation. And if you look at, say, Indonesia, the BKKBN's, the Family Planning Coordinating Board, it's arguing that contraception will decline and that fertility will rise substantially. A fairly alarmist view, which I'm not sure that I actually agree with, but anyway, only time will tell. But, you know, let me be devil's advocate a little bit here. We shouldn't forget that the decline in fertility to replacement level in the West happened in the face of opposition from both church and state, and in the absence of modern contraceptive methods. Where there's a will, there's a way, and motivation is important in terms of family planning. I think we are sometimes a little bit obsessed with the idea that only if family planning programs are very effective in promoting various kinds of methods will fertility, you know, be impacted. Whereas in actual fact, if we look at things like the practice of traditional methods, this can certainly, used in the right way, have a major impact on fertility. And I just want to finish this because I know we're going over time and I don't want to speak too long, but the urban, better educated tend to use traditional methods more than rural, less educated population. And let me just show you a few figures on that for 4 countries. These are all figures from the demographic and health surveys for those countries. But, you know, if you look at Indonesia, Nepal, Pakistan, urban, well, Bangladesh too, urban populations are more likely to use traditional methods than rural populations. And if you look at those bottom 3, that is the educational levels, there is quite a strong relationship that at least in Indonesia, Nepal, and Pakistan, that the better educated are more likely to be using traditional methods, mainly coitus interruptus, but it can also include rhythm. Bangladesh goes the other way, so it's not totally clear cut. But my point is that there are ways, if people want to avoid having children, that they can do so. Unfortunately, one of those ways is also induced abortion, and none of us, I think, would wish for that to increase. But the methods of avoiding getting pregnant in the first place, which are open to people, are certainly something that they can avail themselves of. I think I'll leave it there because I'm very keen to have some time for discussion, and I'm sure the organizer are too. So thank you very much.
Thank you, sir. One of our panelists, Mr. Muqaddar Shah from United Nations Population Fund, was supposed to say a few words but had to leave the meeting. So we'll just move on to the concluding remarks by Dr. Zeba Sattar. So now I would like to invite Chair of our panel discussion, Dr. Zeba Sitar. She will be giving her concluding remarks about today's discussion. Dr. Zeba Sitar is a senior associate and directs the Population Council Office in Islamabad, Pakistan, overseeing technical assistance and capacity building, social science research, and population and demographic dividend research that informs national policy discussions and development. Ma'am, could you please proceed further?
Yes, thank you very much.
You're welcome,
I think Professor Gavin Jones wanted to see if there was time for discussion, but I gather it's pretty late, and I guess the organizers have decided that we'll go directly to my concluding remarks, which is a great pity. But anyway, let me again thank the Population Research Center at the Forman. Yeah, at the Forman Christian College. And I wanted to add that about almost 2 years ago, a team from the Population Council, Sadia Razak and Dr. Arif, were given the assignment to choose 2 to 3 universities across Pakistan where we could set up such a center. It was UNFPA and Population Council who jointly thought that this would really, raise new research, basically have a nice place for interdisciplinary research and, new research on population issues. And they chose the ones that they shortlisted. FCC really came out on top, largely because of their eager interests and also because of the strong interdisciplinary programs that they have in sociology, economics, political science. And today, I know Dr. Arif, myself, and Dr. Ali Mir and others who worked on this project will feel very happy that such a seminar took place, maybe one of your initial international events, because I think it really reflects how demography is really an interdisciplinary science. I mean, it's a science on its own, but works best when we are working across settings. Since this COVID-19 pandemic has struck the world, I think starting from a seminar I attended with the IUSSP, I think it was back in May, demographers have asked themselves the question, how relevant are we? How relevant is this field? And how can we contribute? Because after all, everyone wants to contribute to the solutions and to the studying the problem of COVID itself. And today, I must say the esteemed group of panelists, I would call them a galaxy of stars across 4 continents, have proven, I think, to whoever is left on the seminar, and I think we have a lot of participants still, that how much we can contribute. Really, I think the commonality of the problem, this pandemic, I keep thinking it's a cruel equalizer because we're all experiencing it, sometimes more, sometimes less. But I think we have all experienced the fear, the challenge of containment, the uncertainty, and all the aftermath. So I think that really it's been a feast just to listen to all of you. And I just want to really there isn't enough time to go through each of the talks. I wish there were. But just to point that, look at the type of range of solutions that were offered today. I think let's start with Professor Li Wenjiang, that by showing these important, it seems so simple to do, but so difficult actually. We know that in reality, to do subnational projections and to use all our tools, all our toolkit, wonderful toolkit, fertility, mortality, migration, international, to show the varying effects when they all come together, and important implications for unemployment. I think linking urbanization and unemployment was particularly important from my point of view. And also the uneven impact across the various states. I think it's really something we should be doing in Pakistan and in other regions, sub-regions for our countries, to project what will all this play out to be, even if it is pretty hypothetical, because many countries lack the kind of data that the US have. And then Professor Feng Keshi, sorry if I mispronounced, I'll just call you Professor Feng. I think really you zeroed in on a particular age group that everyone is concerned about, the elderly, but there are other age groups that we could focus on in the same way. And really by focusing on a particular age group is really how we get to the solutions of how to tackle the pandemic as it affects them differentially. And I think you gave the example of China and public policy and how we handle the pandemic. And really that will distinguish one country from another. So again, proving how important our toolkit is. And then Professor Weisen, I think I like your transition to look at issues of you provided the demographic profile for Europe, but why in the southern countries of Europe there is greater number of infections. And it's so obvious, family living arrangements are at the core. And I particularly liked your call for demographers looking, and I've made that plea through a couple of op-eds here. We should be really be looking at the broader, the macro problems, and how can demographers contribute? And I'll come to one or two of them. Again, Dr. Arif, I think your very careful study of migration, mainly international, but even migration internationally, internally is going to be huge. I mean, look at countries like India. I mean, huge movements of population as the shutdown happened in India, and whether they'll be able to return or not. Will it really change the whole fabric of the country, really, if many of them do not return, with ripple effects on many sectors, housing, on employment, and so on. It particularly affects us, as you pointed out, if we get a batch of, not just, we cannot send out new migrants, our economy really so depends on it, but and there's a return migrants, it's going to really put huge pressure on an already very shrinking domestic labor market situation. And then finally, I think Dr. Gavin Jones really, I think you really pointed out that we shouldn't really expect things to happen and, it's not a textbook situation. It can go either way. I mean, you took the example of fertility and family planning, and I totally agree with you. I mean, I think people find solutions, creative solutions, and it is really, we should be studying what it does to the psyche, what it does to the motivation and the values around family and spacing. I mean, we shouldn't assume that just because there's a disruption in family planning services, there may be huge things going on in people's minds about postponing marriages or maybe bringing them forward. Maybe it gives you the value of how limited our life is and how uncertain it is, and you bring certain demographic events forward. So I would like to sort of say that for the younger people and people who are really studying population, and there are lots of them on this call, I think I would urge you to really relook at some of the topics that demographers have kind of overlooked. I mean, migration is the obvious one. We were so obsessed by fertility and mortality. Migration is so interesting. It really impacts on on the economy and on the politics of a country, and also focusing on family and family arrangements as they change, maybe in a sort of very fast way during COVID, but what about living arrangements and care for the elderly, care for children, which has really become a big issue in every household. Since now kids are going to be staying at home, they're out of school, people have to work from home. How do you juggle all these things? So this is all the domain of what demographers, especially in an interdisciplinary, where they have sociologists around them and economists, should be studying together, along with dealing with I think, an important debate, I see it in the US and I see it in Pakistan, is really a political debate about lockdowns, about whether lockdowns will, where is the greatest impact on lives, saving lives? Are we doing it for saving lives, or are we doing it for saving livelihoods? And this is a debate almost in every country. Some countries have, taken it, full head on and made decisions. In Pakistan, the debate is still going on, and it's a huge political debate. Shouldn't we be part of that debate by showing exactly the projections of how many lives will actually be saved by doing a lockdown on day 1, day 10, how many we might have saved by doing a lockdown earlier, and how does it really affect livelihoods? Do we really save the economy and preserve livelihoods by doing lockdowns? I think we need to be part of those numbers. I see a lot of other people have jumped in with their opinions, economists in particular, but we haven't really made our contribution. So I would like to say that to the newly formed, it's only about, I think, year and a half or less old population center at FCC, congratulations. But I think you should take this seminar and use the wonderful connections of all the esteemed group of panelists that you've got. They all belong to prestigious institutions across the world. This is what we want. We want you to form relationships with them and do joint research and learn from what's happening in Europe, Australia, Singapore, and the US. International collaboration. I think one of the panelists, I think Dr. Weisen said, I think this COVID has really it's closed our immediate world, but opened our minds to the possibilities, how you can write papers. I'm doing this a lot. I mean, a lot of people have discovered colleagues across the world tackling similar problems. We can do so much because current technology allows it. And I would really say that FCC should really, and so should everyone, benefit from this. For Pakistanis, I think today's presentations, each one of them had important findings, and I hope the recording will be shared for what we should be studying, and ranging from points of contacts, the spread, the containment, what age groups to focus on, what death rates to compare, which regions to compare across. And I think it really has been a wonderful time. I could go on and on, but I know it's late. I want to thank everyone who was responsible for bringing this together. I know some of my colleagues were, along with the PRC. I think all of you did a fantastic job. And I see now we've dwindled from about 70 participants to about 49. So before we go down totally, I would say I should stop and really thank you again and congratulations. Thank you.
Thank you very much, Dr. Zeba. Originally, we had planned for a 30-minute Q&A session, but we didn't want to stop the speakers. All the presentations were so informative. But I would like to tell the audience here that if you have any questions, please feel free to email them to us, and we will forward them to the panelists. So the important thing that the discourse should keep on going. And that is, I think, what Dr. Zeba also pointed towards. So please send us your questions. The recording of this session will be available. If there are any questions, please send them to us, and we will forward them to the panelists. And we would like to stay in touch with the panelists. In fact, some ideas that they have, we could definitely try and replicate those studies in Pakistan. So I would, before I conclude this panel discussion, I would invite Dr. Sikandar Hayat, who is the Dean of Social Sciences, to please present his concluding remarks and a note of thanks to the speakers. Thank you, sir. You're muted, sir.
Okay. Can you hear me now?
Yes.
Okay. It's my privilege to thank all of you who made this webinar such a great success. Indeed, I'm pleased to propose the vote of thanks on this very lively and stimulating seminar. We have had a number of seminars in the past sponsored by the PRC, the Population Research Center, and supported by the Center for Learning and Teaching, CLT. But I believe this one has been an outstanding seminar, and as Dr. Zeba has also pointed it out. It has been full of ideas, interpretations, visions, data, and analysis. I guess it will be a while before we could really sift through all this and develop and consolidate our individual perspectives. It will take a while. There is indeed plenty to reflect upon and enhance our take on the subject, which is, quote, demography and its role in understanding the COVID-19 crisis, unquote, a crisis that has changed the world like never before. Let me begin by thanking the PRC, particularly Dr. Waqas, its director, and his staff, and the CLT, headed by Dr. Rukhsana Zia and ably supported by Suleiman Khairullah. They made it possible for us to hear our distinguished panelists from China, Singapore, Netherlands, Australia, with one of our own from Pakistan. This diversity of speakers also made it possible for us to approach our subject from a multidisciplinary, multidimensional, indeed global perspective, covering both developed and developing world. In this context, I wish to acknowledge with sincerest thanks Dr. Liwen Jian, Dr. Feng Kushi, Dr. Leo van Wessen, Dr. G.M. Arif, and Dr. Gavin Jones for their insightful, thought-provoking contributions. It was indeed a great learning experience for me, I can say that for sure. I'm also grateful to our co-chair, Dr. Jonathan Eggleton, for a very warm welcome address, and the chair, Dr. Zeba Sattar, for her concluding thoughtful remarks. It deepened our knowledge and understanding of the COVID crisis around the world. Dr. Zeba Sattar and her Population Council of Pakistan, along with UNFPA, United Nations Population Fund, have been a great source of support and strength to PRC, and we are truly grateful. UNFP has been funding us from the start, since the inception of the center last year. We can't thank both Population Council and the UNFPA enough. Both are making a significant contribution to teaching and research on demography and population studies in Pakistan. And we would love to be part of it as we are right now. Finally, I would like to thank all of you once again, chair, co-chair, panelists, and participants who joined us today. I hope our paths will cross again and soon. In fact, Dr. Zeba Sattar has already promised that will happen hopefully next year when we will have a conference, inshallah, if everything goes well and we are done with this menace of COVID-19. In the meantime, take care and all the best. And let me hand it over to Dr. Waqas. Maybe he has some further announcements to make. So thank you so much, all of you. God bless.
Before we conclude, I would like to inform the FCCU faculty that the video of this panel discussion will be available through our website. We reviewed around 30 articles in preparation for this event, and all of those articles are available on our research repository, which can be again accessed through our website. I would like to again thank Dr. Jonathan Arrington, Dr. Zeba Sattar, Dr. Levin Jiang, Dr. Feng Ji, Dr. Van Wyzen, Dr. Muhammad Arif, Dr. Jones, Dr. Douglas Trimble, and Dr. Gloria Caleb, who are both our vice rectors, for joining us for this event. Thank you very much, all of you, and we will see you soon, inshallah. Good night. Good night.